Chapter 25: The Public Health System and the Future of Public Health Source. Mary-Jane Schneider, Introduction to Public Health. Public health doesn't happen by accident. It's a system, a network of local, state, and federal agencies working together to protect the public's health. But like any system, it faces challenges: underfunding, unequal access, political pressure, workforce burnout. In this chapter, we explore how public health is structured, what it does, and where it must go next to protect population health in a rapidly changing world. The local public health system. Most public health services happen locally. Local health departments inspect restaurants and water systems, run immunization clinics, track disease outbreaks, offer maternal and child health services, but resources vary. Some serve entire cities with full labs and staff. Others serve rural counties with a skeleton crew. Funding depends on local tax base, state contributions, federal grants. Bottom line, where you live determines what you get. The state's role: state health departments, license healthcare providers, regulate insurance, coordinate Medicaid, operate state public health labs, set disease reporting laws. They also serve as a bridge between federal funding and local implementation. But politics can complicate things, especially when science and policy clash. The federal government at the top sits the U.S. Department of Health and Human Services, or HHS. Key federal agencies include CDC Epidemiology, Outbreak Response, Health Promotion; NIH Medical Research; FDA Food, Drugs, Medical Devices; CMS Medicare and Medicaid; RSA Healthcare Access for Underserved Populations; SAMHSA Substance Abuse and Mental Health Services. The federal government sets broad goals and provides funding, standards, and national coordination. The core public health functions. All levels of government share three essential functions. 1. Assessment, collect and analyze health data. 2. Policy development, create strategies and regulations to protect health. 3. Assurance, ensure services are provided equitably and effectively. Whether responding to an outbreak or promoting clean air, these are the foundation of all public health work. The workforce crisis in public health COVID-19 highlighted what many already knew. The public health workforce is under-resourced, underpaid, and overstretched. Many professionals retired during or after the pandemic, left due to burnout or political attacks, struggle to manage both routine and emergency work. We need investment in recruitment and retention, training in leadership, communication, and data science, more diversity and local representation. Without a strong workforce, the system can't function. Modern challenges and the future. The future of public health must address health inequities, climate change, chronic disease, mental health, misinformation, technology and surveillance ethics. Solutions include collaborating across sectors, for example, housing, education, using data for targeted interventions, advocating for health in all policies. Public health must be flexible, science-driven, and community-focused to meet tomorrow's needs. Conclusion: the public health system is invisible when it works, but essential when it fails. It ensures clean water, safe food, disease control, and emergency response. But to succeed, it needs stable funding, skilled professionals, public trust, political will. A better future starts by investing in the system that keeps us safe, even when we don't see it working. Call to action. This video is based on Chapter 25 of Introduction to Public Health by Mary-Jane Schneider, 6th edition. If this helped you understand how the public health system operates and what's at stake, share it. And in the comments, tell us, what do you think is the biggest priority for strengthening public health where you live?